Welcome to the Defense and Aerospace Reports Weekly Cyber Report, sponsored by Northrop Grumman. I'm your host, Vago Muradian. Joining us today is Greg Garcia, the Executive Director for Cybersecurity at the Health Sector Coordinating Council, a coalition of industry associations focused on improving the security of the nation's health infrastructure. Greg, thanks very much for joining us.
I'm glad to be with you. Thanks for having me.
It certainly is an unprecedented time. Coronavirus has been unprecedented in sort of the severity with which it's hit the global population as well as global economies. But it's also unprecedented how the global healthcare system has surged to try to take care of as many people as possible, especially in hotspots, but also how the scientific innovation base has surged. You know, in India and the United States, we've got folks who are starting to prepare to make vaccines while they're in trials. Some of these drugs look like they're very positive. More than ever, people are operating and researching on a distributed basis, but also there's more concern than ever about Chinese and Russian hacking of these medical systems. Obviously, from a Chinese perspective, you want to be the guy to bring a virus cure maybe to market, and the public relations benefit that will come from that. Talk to us a little bit about the report you guys issued, because you guys looked at this issue, cybersecurity best practices for protecting innovation capital, that was released last week. Start us off by giving us sort of a sense on what the core of that report was.
Thank you for having me on this. You know, you mentioned what is unprecedented. And one thing that is not unprecedented is economic espionage. Okay, that's been going on for as long as we can remember. Any nation states around the world are always looking for a competitive advantage for their domestic industries. So this is nothing new to us, but the COVID pandemic has certainly shined a bright light on how economic espionage can exploit this kind of an emergency situation where, as you said, you have distributed research around the globe from pharmaceutical companies and research labs trying to find a vaccine, and the race is on. And when we are in this kind of high operational tempo in our healthcare organizations, our pharmaceutical companies, that's the time that we need to be just as high tempo on protecting our innovation capital, protecting the data that's flowing across borders and that is housed, stored within our databases, because this is the time when the nation states, and using advanced persistent threat techniques, are going to try to exploit our systems and steal data. So we are on high alert now, and this guide on protecting innovation capital provides some guidance to health systems and companies about what to be looking out for, and it provides a bunch of case studies of how the use of cyber attack and cyber exploitation has resulted in the theft or corruption of critical innovation capital.
Well, talk to us a little bit about what the evidence is of interference and how that interference or exploitation or hacking or stealing is manifesting itself, and how this incredibly globally diverse ecosystem that includes governments, universities, industry analysts, hospitals, individuals, what do they need to do to protect themselves?
Yeah. Some of the evidence, one of the statistics we use, and this is not specific to the healthcare sector, but the Office of the Director of National Intelligence recently estimated that this country loses about $400 billion annually from economic espionage through hacking. And so that is all the ways that that nation states can either use hacking directly into systems or social engineering, getting phishing emails directly to executives or researchers, getting them to click on malicious links or go to infected websites. And this is all a way of worming into databases, networks, and stealing information. And so, the kind of innovation capital we're talking about is what everybody knows. They are trade secrets, they are patents, they are process controls, process patents, business models, data sets, analyses of that. These are the things, these are the crown jewels of companies and labs that are going to lead us to vaccines or any other kinds of innovation, and those are what's most at risk. And so, the most basic things that organizations need to do, we break it down into two areas: passive measures and active measures. Passive measures is just you got to have governance and oversight. You got to have policies and procedures. People need to understand what their responsibilities are in the enterprise. But then the active measures are really the use of technology through detecting and preventing loss, exposure, and theft. They are working with government, working in the community across with other healthcare organizations through an information sharing and analysis center, the Health ISAC. These are all the kinds of active things that organizations need to do, as well as the basic things like asset inventory. What is your data you're trying to protect? Where is that data housed? How is it being transmitted within the organization, to other organizations, through the cloud, through software as a service, across borders? What are the assets and what is the data that you are trying to protect? Where is it going? How important is a particular piece of data? So it's about assessing risk and prioritizing data so that you can devote your resources most effectively and optimally to protecting the most important data.
Everybody has been talking about improving cybersecurity for a long time. Everybody acknowledges the importance of health information and personal information in particular. And yet, despite these efforts, the system is still much more vulnerable than it should be. What are some ways, we've got, for example, the Department of Homeland Security's Cyber Infrastructure Security Agency, CISA, that started under Suzanne Spalding. Now it's Chris Krebs is heading it and doing a tremendous job there. But this is still a lot like herding cats. What do we foundationally have to do to enhance that cooperation on an international level, on a domestic level, again, among all the stakeholders in this system, as well as with law enforcement and intelligence and government agencies, to make sure that we get to a security level, right? I mean, does this have to be fire code safety, like, strictures to try to improve this ecosystem?
Yeah, and that's a great question. And I've been at this. I was the first Assistant Secretary for Cybersecurity and Communications with the Department of Homeland Security under President Bush back in 2006 to 2009. And in some ways, the more things change, the more they stay the same. There's still a lot of the remaining challenges, but one of the things we have to, you are right that while the healthcare sector has really become mobilized very aggressively and very energetically over the past 4 years against cybersecurity threats, we still have tremendous challenges to overcome. And one of the principles that everybody really recognizes and understands is with cyber defense, you have to be successful 100% of the time to keep the bad guys out. In cyber offense, the bad guys, the criminals, the nation states, you only have to succeed once. You only have to succeed once to get into a network, to get the data and steal something, corrupt the system, disable the system. And so those are tough odds. So how do we deal with that? In addition to every enterprise having somebody in charge of cybersecurity and doing all of the best practices we all know well in terms of protecting your own four walls, protecting your data and systems and architecture, we need to have a community approach. And that, I believe, is what the Department of Homeland Security and the CISA directorate is really focused on. Is a whole of community approach, because none of us individually is smart as all of us collectively. And so that's why, the first thing I recommend on the industry side is that healthcare organizations need to be a member of the Health Information Sharing and Analysis Center or other ISAOs. These are collaborative organizations that brings that neighborhood watch approach. You have to be, being forewarned is being forearmed. That's number one. Number two is working with the government. Information sharing and threat intelligence information sharing with the government is essential because they have intelligence and information that the industry does not have, and the industry has intelligence and information that the government does not have. Industry has global footprint, government has a global footprint. We need to be sharing that information. It has been a common refrain throughout the years that too often information sharing is a one-way street from industry to government, but not the other way around. And this is often the case with law enforcement and with the intelligence agencies. And so there needs to be a shift in government away from need to control information to, or need to classify information to need to share. Because if we don't, the adversaries are going to take advantage of our lack of coordination. So that, I think, is really most important. And we're seeing improvements there, and there are good relationships with the intelligence community and with law enforcement, but I think we need to step up the game.
Well, but we keep talking about this. We just had the Cyberspace Solarium Commission. We talked to both co-chairs, Senator Angus King, as well as Representative Mike Gallagher from Maine and Wisconsin, respectively. And the whole drive of that commission was to do the 9/12 report before 9/11 in order to try to avoid it. And yet, in each one of these cases, we continue to not be as secure because there are a whole variety of factors that go into this. Are we always going to be in sort of a rear guard position on this, where it's not going to be as secure as we would like it, in part because of how adaptive the threat is? Or do things like blockchain and more, stiffer penalties, stronger requirements change that ballgame? I mean, what's the way to fundamentally change the equation? Because it always seems like we're a couple of steps behind wherever the nation state adversary is, or even the criminal element is.
Well, a cynic would say go back to paper and pencil, because that's the only way you can protect yourself from cyber hacking. And I say that in jest, but I think you characterized the environment pretty accurately. The thing is, as long as we continue to have technological innovation is going to lead us to better solutions, better way of life, better productivity, and better security. But the same technological innovation that leads us to better security is also going to introduce new vulnerabilities. Even if we're talking about blockchain or artificial intelligence, adversaries are crafty, and it is a never-ending chess game, right? It is a chess game without checkmate. And so I think, you could ask the same question: when are we going to stop crime? Well, you tell me. When are we going to stop crime? We are not. It is human nature. So I think what we need to continue to do is keep shining a light on it, as you guys are doing with this webinar, in that we have to keep investing in security. We have to keep training. We have to keep pounding the drum and keeping our attention on it. I don't want to be the one who is going to prognosticate a cyber Armageddon or some kind of dark rain. I don't want to hyperbolize this problem, but we do need to be continually vigilant. And I really can't say it any more emphatically that it's just a matter of trying to keep up.
Greg, look forward to having you on again in the future, especially as we keep following this issue. Thanks so much, and best of luck to you guys, and stay well.
Thank you very much. Good to be with you.
And thanks for joining us. Please follow our daily interviews with top government, military, industry, and thought leaders at Defense and Aerospace Report, and subscribe to our weekly newsletter. Follow us on Twitter at DefAero Report. That's at DEFAERO Report. Like us on Facebook at Defense and Aerospace Report. Check us out on LinkedIn, and we'll see you again tomorrow.